Welcome, viewers and listeners, to CHP Talks. We're happy to be here again with another special guest. This week we have Svetlana Dalalana. Svetlana is a registered nurse of 20 years experience. Now she's a wellness advocate. She lives in Grand Forks, BC with her two children, and she is the founder of Ezra Wellness. Ezra Wellness has a vision to empower mind, body, soul, and spirit, and that's pretty comprehensive. So Ezra, the institution, was born in just recently, September 2021, in response to an eroding medical system that has discriminated against and sidelined unvaxxed healthcare professionals who declined the jab. Ezra believes in disease prevention and health promotion at the core. And every human being, this is a statement of theirs, deserves the right to health and wellness without question. And having the right to bodily autonomy, the right to refuse unwanted treatment without discrimination or segregation is a foundational philosophy of Ezra. Ezra believes in empowering the participants to help heal themselves through a holistic approach. And Ezra means helper in Hebrew. And we, of course, recognize that God is the ultimate healer. Ezra is a powerful wellness movement growing across Canada. It's a light in the dark for those seeking health for themselves and for their families. And importantly, Ezra does not discriminate or segregate based on your medical decision. So, Svetlana, thank you for joining me today on CHP Talks. We had a nice chat last week. I'm so excited what you're doing, and welcome to the program.
Good morning, Rod. Thanks for having me. I really appreciate you taking the time and showing interest.
So you are based out of Grand Forks. That's where Ezra Wellness began. And now you have been for some days in the Lower Mainland, making a lot of connections there. And what are you finding when you talk to people about the concept of Ezra Wellness?
Yeah, so I think Ezra Wellness represents, our health, and everybody is concerned of their health. So we all have this common denominator of wanting to be healthy and living a prosperous life. And currently our healthcare system is in an emergency state across the country and in fact across the world. So we all share the same passion and the same drive to live a good life. And at Ezra, we want to change the medical model, and we want to transition to something called health promotion and disease prevention. And we want to really, bring forth that, your mind, body, soul, and your spirit is essential to good health. So it was, I saw the writing on the wall September of 2021 when I was working at a primary care physician's office in Christina Lake, British Columbia. And I took note that the Bonnie Henry's public health orders were going to be affecting all healthcare professionals in British Columbia. So as of October 26th, if you did not receive your first jab, then you were let go, unpaid leave of absence. So, in my mind, this was a firing without pay. And, you couldn't even collect employment insurance. So this was a real life changing for these healthcare professionals that stood in their faith, that stood in their decision not to get vaccinated. So approximately probably 30% of our local healthcare professionals chose not to get vaccinated. This was a huge number to me. This is something that really affects our healthcare system. On one hand, if this was a real pandemic, our health authorities would be fighting tooth and nail to keep our healthcare staff well and working, but instead they fire them without taking the vaccine. So this was a real concern for me. This is not right. This was clearly wrong and unjust. So we married that concept to the eroding patient care. So March of 2020, when the pandemic came on scene in BC, we released the major problems started, real hard time accessing their family physicians, their healthcare providers. So the access started to erode at that time.
And of course,
and we also sorry, go ahead.
well, one of the things, not only patients not being able to access health care, but those who are in hospitals, long-term care facilities, when they need their families the most. Of course, they're being restricted access. The government is holding these vaccination, they've got you in an arm lock. If you want to do what you know you're supposed to do, is be with your family, well, then you have to cooperate with Bonnie Henry. And we know good people who have served for 35 years in a local facility here, have been giving good patient care for 35 years, and now they're just booted out the door like so much trash. It's shocking to the core that within a short period of time, our country could have taken this step.
Yeah, you know, this is actually a very important discussion here. This is the ultimate crime against humanity. And let's bring attention to this for a moment. So currently, if you're unvaccinated, you are having major troubles. If not, you cannot see your family members in the hospital. This brings on so much mental turmoil to both the patient who needs their family members and the family members who needs their loved ones. So currently, if you're not vaccinated and you want to go visit your, for example, your mother in the intensive care unit, we have a live story right now happening in Trail, British Columbia. And the story has gone live. I have permission to discuss the story. So a 69-year-old female was admitted to the Trail Hospital in the intensive care unit with diagnosed with pneumonia. She was intubated, and she currently remains intubated. And her son, Sean Patterson from Nakusp, British Columbia, is unable to go see his mother. So the patient does not have an advocate, and Sean, who's trying to see his mother because he's not vaccinated, is being denied access. The crime against humanity that we are currently addressing.
Yeah, and even I know, like, I've had family members in the hospital over the years, and although generally we've appreciated the great care that they've received in many ways, but also the family members in the room have been part of that care. And usually there's been a good interaction between the nurses and other care workers, because they recognize that the family is contributing. They're not just there as observers, they're actually contributing to the recovery of that patient, and taking some stress off of the staff, because they're making sure that their family member is getting, food and water and having their needs met. It should be a cooperative relationship, not a confrontational one. So this really flies in the face of everything we know about good patient care.
You're absolutely right, and my backbone, Rod, is intensive care unit. I've been ICU nurse for all my career, and you raise a really good point. It's a really nice and special thing, even from a nursing perspective, to have that family member beside the bedside. Caring for that, it lessens my load as well, so I can then continue on with other patients. So we have it's a couple of twofold. The bedside nurse now has even more of a workload responsibility. So great point.
And especially at a time when they're firing bedside nurses and other healthcare professionals, so they're reducing the workforce at a time that they claim that that we're in a situation that needs all kinds of sacrifices and whatever. They're firing the ones who could be helping, win the battle, and then keeping out those who could be an emotional support, at least, if not even a practical support in terms of patient care. So across the province, I know that there's an Ezra Wellness opening up in Kamloops. And where else are there? I mean, maybe you're in initial stages, you may not want to discuss all of them, but you're having more than a couple of places where there is interest beginning Ezra Wellness. Can you say anything about that situation?
Yeah, well, we're full disclosure. We are absolutely full disclosure. The public has a right to know what's happening, and that's the philosophy that we want to carry through with Ezra forever. The the public has a right to know, where they can get healthcare access, how monies are being used. This is really important. So, for example, we have a Kamloops physical location. So they are their doors are open, and they are serving their participants. So in the new healthcare system, which is the health and wellness, we're using different language. So we're adopting participants as opposed to patients or clients. So we have an Ezra Kamloops physical location, and we have an Ezra Grand Forks physical location. But on that note, we do a lot of home visits. So we have a lot of nurses going to patients' home, which is a beautiful thing. So we have, I would say, over probably 40 locations right now in British Columbia that are the groups have formed. So the healthcare providers are forming, they found each other, and this is also a support network for them as well. So as well as they're getting their business plans together, they're getting their skill sets together, they're starting to reach out to advertise their community that they are available to help, and we're doing a lot of home visits. So this is a really beautiful thing, and this is we're a lot of online. So we have our huge online networks, and we do a lot of referrals. So off the top of my head, I can share with you the communities in British Columbia and Alberta, and rolling out east. So Grand Forks, Greenwood, Beaverdell, Castlegar, Trail, Nelson, 100 Mile House, Prince George, Dawson Creek, Nanaimo, Victoria, Comox, Parksville, and the list goes on for British Columbia.
Yeah, wonderful.
Alberta, we have Edmonton, Calgary, Red Deer, and Saskatchewan is starting. London, Ontario, Chatham, Greater Toronto area, Nova Scotia. So basically the goal is wherever there's a healthcare system currently in Canada, we want to parallel that. And as the mandates roll out, the communities and the healthcare people are saying, okay, boots on the ground now for action. So we're in the middle of a war, and currently we're pop-up first aid tents, and we will evolve into something very beautiful. I'm confident with that. We're developing our network systems, and we're recreating healthcare in Canada. It's a big project, and everybody is very motivated to make this happen.
Very, very ambitious project, and thank you so much, you and those working with you, to take it on and not be scared away by the size of the project. So I just have to unplug my phone here for a second. So what is the range of services you're able to operate or to provide? Because as I understand, you're operating outside of the sort of the covering of your colleges, where you have trained and got your licenses, but you're not able to do all the things probably that would happen within a medical facility sanctioned by Bonnie Henry and Adrian Dix. So what's the range of services that your people can provide?
Yeah, this is a hot topic. I'm excited to talk about it. So we are working within our skill sets now. So for example, I've been a registered nurse for 20 years. I have an amazing broad skill set that I can offer my patients, now participants, right? So we're moving away from our colleges as registered nurses, and we are now wellness advocates. And again, the language will be morphing as we move forward in this project. So my skill set actually has opened up a lot. So our colleges, Rod, are part of the corruption piece to this. So when my college tells me that I have to give my patients vaccines, or else they no longer have access to healthcare. This is wrong. This is clearly wrong. So I don't support my college's position anymore. I don't represent them, and they don't represent me. So we're moving away from our colleges, and obviously our health authorities have kicked us out. They don't want us anymore, and the unions are crumbling. So the whole institution of healthcare and regulatory bodies is it's currently crumbling down, which is okay actually, because they've been corrupt for a long time. And we're going to recreate our regulatory bodies. We're going to recreate our competency models, and we're going to move forward. So we're currently working we're in alignment with the Canada Health Alliance. This is healthcare professionals across the country: nurses, doctors, naturopaths, chiropractors, massage, physio, nutrition, functional medicine. And we are recreating our regulatory bodies through this. We believe that we always want to have a high level of competency, because that's who we are. We're actually the cream of the crop all-star team across Canada, and we're also the new educational program. So we have a lot of university students reaching out to us. Currently, the universities are telling their students that if they're not double vaxxed, that they have to leave their programs. So we have a lot of students reaching out to Ezra saying, hey, can I jump on board, and can you now train me? And we said, absolutely yes, because this is our future generation, and we need to support them, because one day we would like to retire.
Really, I don't know if that'll be allowed. There might be new health regulations not allowing you to retire. No, just kidding.
So we're creating our own health regulations. We are recreating
right.
something that is based on truth and integrity. And there's so many of us that this is not stoppable.
Mm-hmm. Wonderful, yeah. Wonderful.
Mm-hmm.
So how are your participants, those who provide care, how are they compensated? Or what's obviously you're at the very beginning stages of developing this, but what happens today as far as one of your healthcare providers participates, and but they've got to eat too. So how is that looked at?
Yeah. So I mean, this has been a huge blow to the current healthcare people that chose not to accept a medication, a vaccination. So this is very traumatic. We're in the grieving stages: anger, shock, denial, depression, acceptance. So we're supporting each other and doing our best to move forward, and then then providing patient care again, participant care again. So currently it's all by donation. Okay. So we provide a service and we accept donations. Mm-hmm. So this is I've termed public-private model. We're going to do our best to tap into the public system, because, hey, let's face it, we're taxpayers and we pay into that system. So that's our right to access it. So we're as an advocate, as a wellness advocate for the participant, we realize that healthcare is expensive, and we want to keep the costs as low as possible. So we're going to tap into the public system as much as we can, and then the rest will be for private pay, and that currently is by donations. And people are happy to pay for a good product, right? Yeah. You get what you pay for. And we offer something, I believe, that is very high quality. We're very experienced. We were good enough for our health authorities last month. Yeah. And so we stand by our knowledge and our skill set. And the patients, the participants will be the judge of that. And so far we're getting really great feedback. And so it's all by donation currently.
Well, that's wonderful. And that's a real step of faith for your members that are stepping forward to provide the service, just because, and recognizing that there's like nowhere else to turn right now for many of these folks. And it is a spark of, it's a place of light or hope for those who have been just suddenly, trashed after 20, 30 years of faithful service, to the citizens of British Columbia and suddenly be kicked out the door, like it's unbelievable, really. I still can't wrap my head around it. But you are providing a place where those people can come together and, get a new vision for what it looks like in the days ahead, right? And provide a
that's
service
true.
that's very much needed.
And as this evolves, I'm learning a lot of things. The learning curve is huge for all of us. And every time we do an interview, I learn more and more things, and I want to incorporate that information. So, I really want to stress that, Ezra is we don't discriminate and we don't segregate. So, for example, if a vaccinated nurse chose to say, hey, like leave their current profession in the hospital and wants to come be with Ezra, like we will welcome them with open arms. This is not vaxxed against unvaxxed, actually. We're inclusive. So I haven't said this yet, but it should have been obvious, but if it's not obvious, I want to say that if you're a vaccinated healthcare professional, that you want to do a different way of health and wellness, our arms are open always. And we're currently doing a lot of intakes for vaccine injuries. We want to hear from you if you've been vaccinated and you think you have an injury, because in our current medical system, they're not honoring it. It's called a normal adverse reaction. That's what they're labeling it as. But Ezra, these are real. These injuries are real. We want to hear from you, and that's going to start your healing process. We're also working very, very hard to figure out ways to treat your vaccine injuries. But it starts by hearing from you.
Yeah, excellent, excellent. That's much needed. I know Canada's reporting system is very cumbersome. I've looked at the forms. If you or a family member has been injured by this COVID experimental injection or any other medical practice, for that matter, procedure, it's not a simple matter of just putting down your name, what you're feeling, and someone's going to come and talk to you. No, you got to fill out pages of information. And I think for many people, especially if they're in the middle of a crisis, it's going to be too intimidating for them. So we know that the reporting of these vaccine injuries is very low compared to the reality on the ground. So I think if you open, and I'll just make a suggestion then, when you probably are going to do this anyway, but when people come to you with a vaccine injury, that you could help them get through the paperwork. Because right now, if you look at the reports that have come in, they can say, oh, they're very few cases, because people just get intimidated at the reporting stage.
Yeah, I've looked at the paperwork as well, Rod, and it's probably like a 16-page document, a very, very complicated document. A vaccine injury should be treated like anything else. For example, you have a broken leg and you come in, you don't have to do 16 pages of paperwork to prove that your leg was broken, right? This should be something just very simple and moving forward. Actually, we're not participating in that corrupt paperwork.
Okay.
We're not even dealing with the old system. The old system is corrupt, and we've done our best to try and negotiate and talk our way through this, but there's no talking our way through this. So we're leaving peacefully. We're leaving the old world behind, and we're creating something beautiful. And we are going to get right to the treatment part of it, and right to the healing part of it, because we don't have time. Time is actually not on our side, and there's some urgency to this. So cumbersome paperwork is a thing of the past, and nurses were drowned in paperwork, which took away from the ability to provide even more good patient care. So we're charting. We know exactly what to chart and how to chart it. We're very competent, seasoned nurses and healthcare providers. We're going to chart what we need to and move on to the meat and the potatoes, which is participants, starting the healing process, whatever that might look like.
Tremendous, tremendous. So how does someone get in touch with you? How does someone, either as a healthcare provider that would like to get involved, or someone in need of care, where would they start?
Yeah, this is a really great question. We are developing our communication networks. As you can imagine, it's a massive project. So we have a website, ezrawellness.ca. That's ezrawellness.ca. We even have Facebook groups. We have websites. So if a patient is trying to find, or a participant is trying to find an Ezra Wellness throughout Canada, the best place to start is through the website. And currently we have a lot of just personal connections. So every community has a lead, and then that lead would be contacted and we would disperse it properly. We are working on possibly an app where we can match the patients, the participants, to the right healthcare providers. And this would be, across Canada, which is, I think, a really great idea. So for example, we have, say, a 69-year-old male living alone who needs home care, for example, in Grand Forks, and his kids maybe live in Kelowna, right? So they'll all be able to jump on this app, and they can organize it from Kelowna to working on ways to streamline communication and get the participants what they need when they need it, as soon as possible. So the best place to start right now is ezrawellness.ca.
EzraWellness.ca. And thank you so much, Svetlana, that, not only for being on our program, but thank you very much for what you're doing. It's bold, it's courageous, and, you've taken a step many wouldn't take, but I've found often when someone steps out and gives leadership, many others would like to follow, they would like to see this happening. And when they see the ship moving in a particular direction, they want to get on board. And so I'm sure that will happen with Ezra Wellness, both where you are in Grand Forks, in Kamloops, and across the country as these things spring up. So any final thoughts you'd like to make sure our listeners are aware of?
We're bringing hope, healing, health, happiness back to healthcare. So I just wanted to encourage you guys, as it affects you on a personal note, that Ezra is currently, working really hard to establish something, a landing pad for you and your family. So we look forward to moving this project forward. And you're right, I thought maybe Grand Forks was the only place that needed an alternative option, but this has been something that all of Canada has been thinking, and we align with a lot of partners. For example, Vaccine Choice Canada, Action for Canada, Ezra sits in the World Council of Health, and we communicate with other countries across the world. And what's happening right here in British Columbia is happening all over the world. The stories are the same. So we're moving forward. So I have a saying. I said, "Welcome to the revival in the book of Revelations during the revolution."
Okay, awesome. Well, that's excellent. And we need Ezra Wellness up here in the Bulkley Valley where I live. I know there are, people on both sides, people who need the care and people who are looking for a way to serve as they have done for many years. And so we appreciate.
So on that note, Rod, that Bulkley Valley is there is an Ezra there, and there's a team forming. It's a beautiful team, actually. Wonderful. So we have nurses, we have family doctors, we have orthopedic surgeons, jumping on this board, jumping on this project. So our goal is to even create surgical centers, and that's underway. So this is a community project. We have healthcare people doing what they know best, but we also need a lot of community participation to move this project forward.
Excellent. And you've mentioned a couple of organizations that we love and appreciate too Vaccine Choice Canada and Action for Canada. I know Ted Kuntz and Tanya Gaw, both tremendous people who are doing their part to educate, to motivate, and to provide some direction for those who are confused by what's going on in our country. And you're providing another part of that puzzle. And thank you for doing that. We wish you all the best. And we want to stay in touch with you and see as things develop. We'll be excited to hear your updates and reports. So thanks for taking the time to speak with our viewers and listeners today. God bless you.
God bless you. Thanks, Rod. Thanks for having Ezra.